I'm Dr. Kim Martin. I'm a chiropractic physician in Illinois, and I hold a board certification in integrative medicine, certified in acupuncture, and I'm a member of the American Functional Neurology Institute. I want to share some information with you today about the 6 different patterns of low thyroid function. Now, because there are 6 patterns to hypothyroidism, there's only one that can be resolved with thyroid hormone replacement. Further, 2 or more of these patterns can exist at the same time. Now, a serum blood test is essential along with a complete medical history, detailed symptoms, and prescription drug use. The thyroid gland is very sensitive to any change in your body's chemistry. Your thyroid can sense the slightest shift in blood sugar, chronic inflammation, poor digestion, toxicity, hormonal changes, adrenal problems, and nutritional deficiencies. Your thyroid will compensate for them, but when these shifts become chronic, the thyroid gets tired and slips up. Hashimoto's is the most common cause of hypothyroidism, but there are 6 other factors that can lead to low thyroid function, and only one of these can be helped with thyroid replacement hormones. Most people with hypothyroidism have a functional hypothyroidism, and this is not a thyroid disease and does not warrant long life medication. Over 15 million cases of thyroid dysfunction go undiagnosed every year, and this is because of inadequate blood tests. Most of the 6 thyroid patterns are the result of poor blood sugar control, stress, leaky gut syndrome, a sluggish liver, or hormonal imbalances. There is only one of the 6 patterns of hypothyroidism that will show up on a blood test to measure the TSH, and this is the thyroid hormone test that doctors use most often. Laboratory values are very wide and considered to be normal rather than using the optimal level, which would really indicate a good thyroid health. When the optimal range is used rather than the so-called normal range, a person with a thyroid disorder can be diagnosed much more quicker rather than waiting until the thyroid condition is completely out of the wide normal range, when the disease would be much further advanced. Number 1, there is primary hypothyroidism. When the pituitary gland senses that the thyroid is not performing, it will send out more TSH. This is the primary hypothyroidism and is the true dysfunction of the thyroid gland, and the only one that can be treated with thyroid replacement hormone, unless it is Hashimoto's. Number 2 is hypothyroidism secondary to pituitary hypofunction. This is the pattern of functional hypothyroidism is very common. The TSH will be low and the person will have symptoms of hypothyroidism. Constant stressors are the cause of this pattern because the pituitary gland at the base of the brain becomes fatigued and then fails to signal the thyroid to stimulate more activity. In this case, the thyroid may be healthy, but the pituitary gland is not working properly. Number 3, there's thyroid underconversion. This pattern is due to chronic adrenal gland stress and too much production of the adrenal hormone cortisol. When thyroid underconversion, the body makes the proper amount of T4, but because there is too much cortisol, the body is prevented from converting T4 to T3, which is the form of the thyroid hormone that the body can use. Number 4, there's thyroid overconversion, decrease TBG. This pattern causes too much T4 to be converted to T3 and not enough production of the thyroid binding globulin. This is caused by elevated levels of testosterone in women. This pattern is commonly found in women with insulin resistance and polycystic ovarian syndrome. Number 5, there's thyroid binding globulin elevation. Oral contraceptives or estrogen replacement therapy are generally associated with this pattern. When estrogen levels are too high, such as in the case of women taking birth control pills or using Premarin or estrogen for hormone replacement, the body makes too much of the TBG, which then causes not enough of the free thyroid hormone to be available to enter your cells. Or 6, you could have thyroid resistance. In this pattern, the pituitary gland and the thyroid gland are working properly, but the hormones are not getting to the cells. This is a stress-related pattern. Stress causes elevated levels of cortisol and causes the cells to become resistant to thyroid hormones. I hope that you have learned something from this informational DVD. Stay tuned. Thank you.